Today's spotlighted biotech is Cytokinetics, CYTX. They received exciting news on December 19th, 2025, getting their very first FDA approval for a small compound drug called MyQorzo. It treats obstructive hypertrophic cardiomyopathy. As always, it's important to know some basics about any company that you're getting into the water with. Stick around and we will certainly know a bit more about Cytokinetics. Let's jump in. Joining us is our lovely assistant, Carly.
Great to be back with you, Bobby Swimmer. Tell us, when did Cytokinetics get started?
Cytokinetics has been around for quite some time, forming way back in the late 90s in 1998, with 4 muscle biology pioneers in the hills in San Francisco. Speaking of muscle, at that same time in 1998, Barry Bonds was definitely ripping some home runs, splashing down in McCovey Cove on the Giants. 98 was also the year McGwire and Sosa were chasing down Maris's home run season record of 61. Oh, the fun days of Major League Baseball and steroid-induced long ball. Okay, back to Cytokinetics. They became a public traded company with their IPO in 2004, and they exclusively started focusing on muscle biology in 2008. Powerhouse pharmaceutical Amgen recognized their abilities and entered into an agreement and collaborations with them throughout the 2010s and the 2020s, but they're no longer active together. Despite the ending of their relationship, this did help shape and strengthen, muscle pun fully intended here, of Cytokinetics into the success that they are today.
Wow, that brings back memories. Bonds, McGwire, Sosa. So fun to watch all those homers in the late 90s and early 2000s. So you mentioned after nearly 27 years, Cytokinetics finally has their first home run, so to say, with recent FDA approval of MyQorzo, aficamten.
Yes, it's always exciting to receive FDA approval after all that work, and it's a huge milestone for any company. Just like my Transformer Triptychon here, they will be transforming from their very own clinical stage biotech to a commercial biopharmaceutical company. Big transformation. The pivotal data was from their SEQUOIA study. This showed patients with obstructive hypertrophic cardiomyopathy had significant improvement in their exercise capacity.
Any heart condition with that many big words does not sound good. Tell us more about obstructive hypertrophic cardiomyopathy.
Exactly correct, Carly. You never want any heart condition, especially one that you can't spell. Obstructive hypertrophic cardiomyopathy is a genetic heart condition. This is one you get with an autosomal dominant pattern, kind of the worst of genetic. That means you only need one copy of the defective or broken gene from your mom or your dad. This has a 50-50 chance of getting the bad gene. So if it's in your family history, you don't got great odds. This is why first-degree relatives, mom, dad, brother, sister, kids, are also screened if you ever get this diagnosis of the genetic condition. The genetic defect causes issues with the proteins in your heart muscle that are called sarcomeres. This is the functional component of your heart muscle. These allow your heart to actually do those beating and contractions and generate the force needed to pump out the blood. Over time, though, having this genetic condition causes a defect of the wall of your heart, the one that's between your left and right side of the heart ventricles. When this happens, it starts to thicken. Any kind of pump that thickens, you will start to have issues. Remember, a heart is just a pump. So imagine a pump that's really thick and difficult and stiff to push is not going to be that easy to pump blood around. The obstruction part of the name is because that thickened muscle obviously also narrows the left ventricle outflow. This causes the mitral valve not to fully close, not a good thing. And then you get a little bit of backflow, regurgitation, which means that your heart's even working harder to pump the same blood that it just literally pumped out, but it came back into the heart chamber.
Okay, that gives a brand new meaning when someone says you have a lot of heart in the game. Nobody ever wants too thick of a heart. What symptoms do people have, and how does Cytokinetics new med help?
Okay, I'm going to quote one of my favorite characters from a movie, Serrano from Major League. It is very bad for your heart to steal Jobu's rum. Or he said something to that effect. But seriously, it's very bad to have thickening of your heart's wall and obstruction of the blood out of that left ventricle. As more and more of this heart remodeling keeps happening, the thickening, people will start to feel symptoms more and more. And you get to the point that even light activities, say getting up from your couch, walking to the bathroom, will be exhausting. If your body's tissues don't get enough blood flow, you will start to have shortness of breath, which is a horrible feeling, almost like someone strangling you and you're not even doing anything. So also, if your heart doesn't get enough blood flow, this is going to be that severe chest pain called angina, which is also very painful. And then if your brain doesn't get enough blood flow, you will start to get lightheaded and faint and almost feel like near fainting episodes. All right, let's get back to the good news with Cytokinetics. From their clinical 3 data, aficamten MyQorzo patients, only after 24 weeks on this trial, they showed significant increase in the PVO2 by 1.8 milliliters per kilogram of body mass per minute above the baseline, compared to no change in the placebo group. So this is significant statistically, of course. All right, what is PVO2? Why did they even use that stat? PVO2 is the single best measure of how well your heart, lung, blood, basically your cardiovascular system there, and your muscles work together. Basically, it's like the max horsepower stat of your cardiovascular system. So just like a race car where you say, well, how much horsepower does this baby have? Higher horsepower means that you have stronger performance of your heart, lung, blood, muscle complex there. Low PVO2 is associated with higher mortality, and even just a small increase really does help improve quality of life and, of course, prevent mortality.
So, untreated, it sounds like the ultimate spiral down the toilet drain. So, you can't exercise because of the shortness of breath, but without the exercise, your heart health and shortness of breath gets worse. What are the current treatments, and how does MyQorzo change things?
The first line treatment for the symptoms of shortness of breath, chest pain, exercise intolerance is a very cheap and old school blood pressure medication in the beta blocker class, such as metoprolol, propranolol. They work by slowing down the heart rate and reduce the contractile strength, which often improves blood flow and obstruction. Now, if those don't work, you got to go to the second line. The second line would be what Cytokinetics aficamten MyQorzo is going to be, and of course just approved this month, December 2025. Or you go to Bristol Myers Squibb's mavacamten, which is Camzos, that was approved back in 2022, about 3 years ago. They're both cardiac myosin inhibitors. They work by directly reducing the contractile force in the heart muscle. So they go right after the contractile force. So at the clinical trials, as we just talked about, it showed significant improvement in the heart's max performance numbers as expressed by the PVO2 scores. And that's significant. Interestingly, Bristol Myers Squibb's mavacamten has sales of about 600 million in 2024. That's a decent number, 600 mil. I think any of us would take that. And it's expected to be increased in 2025. So both mavacamten and Cytokinetics have similar history with a lot of their founding scientists. They came from common research labs at Stanford and Harvard.
So, with mavacamten already on the market since 2022, they have a huge head start. How is Cytokinetics aficamten different enough to catch up with the competition?
The short answer is that Cytokinetics aficamten is expected to be more stable as a therapy, which would require less frequent monitoring. Remember, since they both reduce the contractile forces, you could swing too much the other way and they could suppress heart function and cause a left ventricular systolic dysfunction. So what that basically means is the medications will need cardiologist monitoring when you're using it, and the expectations is that aficamten or Cytokinetics improved it so that it's not swinging too much, causing a lot more frequent monitoring and concern from cardiologists that use this medication.
Always exciting to be talking about a medication that receives FDA approval, especially for something as debilitating as obstructive hypertrophic cardiomyopathy.
Congratulations again to all the hard work everyone at Cytokinetics did to make the FDA approval of aficamten MyQorzo possible. Patients and practitioners, I'm sure, will appreciate having more choices. Thank you again, Carly, for your assistance today. And of course, thank you to our viewers for joining us. Be sure to join us for another episode of BioTech Swimmer, where we'll be diving into a new biotech company and keeping it fun and simple. Don't miss out, and be sure to hit that subscribe button.